Today we're going to present our pre-PhD seminars in defective copper metabolism, deficiency, and overload. First of all, I would like to thank Department Coordinator Dr. Fikas Shindu, Department of Biochemistry, Science and Technology, and I would like also to thank HRDC and pre-PhD course, which they prepare for our pre-PhD course, and all our coordinators and doctor and madams, which they are participating in our pre-PhD course. Thank you a lot. First of all, I would like to express about defective copper metabolism, deficiency, and overload. Copper became widely bioactive about 2 to 3 million years ago, with advent of an oxygen atmosphere that allowed for conversion of copper to more soluble copper ions. Become of the ready in conversion between these two oxidative state, copper has become an essential element for all organisms that have oxidative metabolism. In human, it represents the third most abundant essential transition metals as a cofactor several enzymes and as a structural component. Copper is involving in many physiological pathways. Furthermore, copper is associated with an important biological process, including angiogenesis, responsible for hypoxia and neuromodulation. Copper is an essential dietary component required for a small amount, 1.5 to 3 mg per day. And distribution through the body, while the highest concentration are in the liver, brain, heart, kidneys. About 50% of the total copper is harbored in the large mass of muscles and bones. In human, 30 to 60% of ingested copper is absorbed in the stomach and small intestine. The major pathway of copper metabolism and distribution. The metal is then transported from intestine to the blood, where copper binds to albumin at a specific site, or amino acid is delivered to all tissue and including liver. Liver is copper incorporated into iron oxidase, ceruloplasmin, which is synthesized and metallized into liver and exported into plasma. Also in the liver, copper is exerted into bile amino acid and bile acids complex by a way of high capacity excitatory pathway in hepatocytes. The final sequence represents the major excitatory pathway for coppers and metal, so process is not available for reabsorption. Copper transport and utilized in a mammalian cell can be divided into three distinct related to steps: copper intact, copper exertion, copper intracellular distribution and utilization. Next, copper biochemistry and hemostasis. Many enzymes is required for copper biochemistry and hemostasis, such like cytochrome C oxidase, oxidative phosphorylation, cytochrome C oxidase phosphorylation, copper zinc superoxidase dismutase function to superoxidize dissociation signaling, ceruloplasmin function for peroxidase, lysis oxidase function for cross-linking of collagen and elastin, tyrosinase mammalian synthesize, dopamine B monooxygenases, neurobigoprotein synthesize, phenol glycine alpha amidate enzyme activated for peptide hormones, copper amino acids oxidize disamination of aminase, collagen function 4 and 8, blood clotting. Next, copper deficiency and disorders. Copper deficiency and disorders. Copper may from mutation copper deficiency due to the absence of copper in the dietary component, which is utilized daily. So it must be presence of copper inside our foods. Anemia and novopathologies, connective tissue and vascular system, genetics, copper deficiency, monkeys and obesity, hospital horn syndromes, monkeys disease and obitical horn syndromes are X-linked recessive disorders. Monkeys both are caused by genetic defect in the copper transporter ATP7A. The clinical feature of monkeys including severe progressive and neurological degeneration, connective tissue abnormalities, muscular hypotonia, and hypopigmentation of skin and hair. Many clinical symptoms of acquired copper deficiency and monkey's disease can be attributed to decreased activities of copper-dependent enzyme. Those hyperpigmentation of skin and hair resulting from reducing thyrogenesis activities and abnormalities of bone connective tissue are principal due to law of low X activity. OHS is primarily connective disorders due to specific effective of the specific mutation of ATP7A on LOX activity, mostly caused by specialized mutation and allow the production of small amount otherwise normal ATP7A possible when ATP7A is present only in a small amount. It is primarily located in the plasma membrane rather than TGN. Thus explain specific reduction in LOX recessive copper in the TGN. Copper overload disorder. Active copper intact, genetic overload. Genetic overload, which is Wilson's disease. Wilson's disease is an autosomal recessive disorders of copper metabolism, which is characterized by hepatic and neurological disease. The disease affected between 1 in 30,000 and 1 in 100,000 individual. When it is first described by Gunnar Wilson's 1912. In the past decade, we have the major advance in our understanding and pathogenesis, cellular biology, and molecular genetics of the disease. Most symptoms first appear in the second and third decade of the life. In the affected individual, there is accumulation of excess copper in the liver caused by reduction and exertion of copper into the pill. The greater danger of Wilson's disease in progressive can be remain undiagnosed and also be fatal if not treated. It may also cause kingfisher in the eye, in the cornea. So the diagnosis and recommendation in Wilson's disease. Wilson's disease should be considered at any individual with liver abnormalities of uncertain cause of those within onset movement disorders. Assignment should be including history, physiological examination, liver function test, whole blood test counting, serum blood and seroblasmin, and 24 urinary copper exertion, liver biopsy, quantitative copper tissue remaining, the test of biochemical evidence of Wilson's disease. Kaiser-Fisher ring should not be cited using the lamp examination by scaled examination. Family screening of first degree relative must be understanding and taken of genetic disorders. Diagnosis should not be used, especially in the patient with determined the clinical and biochemical feature. Thank you. Thank you.